This short video provides an overview to our MSc in Digital Health Transformation project on video-enabled care in older person services. It was undertaken by Claire Browne, Leonie Finnegan, Patricia Hynds, John Lavelle and Pamela Lonergan.
Pre-March 2020, an outpatient's appointment for the majority of residents was a long and tiring day. This is Tom. He lives in a nursing home 1 hour from his main hospital. Tom attends outpatients on a regular basis and finds the day a challenge. On the morning of his appointment, Tom needs the assistance of 2 HCAs to have him up, washed, dressed and ready for the booked transport. Tom is accompanied by a staff member from the ward who also brings his medication and medical information. The journey takes 1.5 hours due to traffic. When Tom gets to the outpatients, he waits another hour before being seen. His consultation with his doctor takes 8 minutes. Tom then waits 30 minutes for his transport before starting his return journey home. There has been little chance for Tom to mobilise, and sitting for long periods results in him being at higher risk of developing a pressure sore. On return to his nursing home, Tom is exhausted and all he wants to do is sleep.
There are approximately 30,000 people currently living in nursing homes and residential care facilities in Ireland, and over half the deaths from COVID-19 were experienced in these care facilities. While increasing the measures and efforts to protect the older people in their care, the residents and their staff experienced a lengthy disconnection and isolation from families, their support services, and other health professionals.
Video-enabled care supports the provision of essential services by allowing healthcare professionals to participate in clinical encounters through a communication platform instead of attending face-to-face.
This project presented an opportunity to study implementation of video-enabled care in this setting using a mixed methods approach in order to evaluate the success factors and barriers and develop a framework that will support future implementations. Here we have set out our objectives.
The main pilot site was Waterford Residential Care Centre, a purpose-built 80-bedded centre providing a multidisciplinary team approach to care in close collaboration with Waterford Integrated Care of Older Persons and a newly appointed community geriatrician. The implementation of video-enabled care was targeted in the rehabilitation service, requiring engagement with a range of internal and external stakeholders. They included the residents and their relatives, Director of Nursing, the nurse managers and staff nurses, health and social care professionals, older person services managers, and the HSE National Virtual Health Team with the HSE National Lead for Older Person Services in the ONMSD and our academic supervisors.
My name is Mary Veal. I'm the Director of Nursing in Waterford Residential Care Centre and St Patrick's Hospital. Video-enabled care has been invaluable to our service during this COVID pandemic and will be invaluable for the service going forward in the future.
I think it does definitely make therapy and access to therapy more accessible, especially for people who are less mobile or people that don't have access to transport or can't access public transport easily. So I think there's a major plus in it from that point of view. And also I think the world is advancing in technology, so I think healthcare should as well.
See the patient-centred care that they're getting by seeing their family. Way forward, we can always use it because I suppose with the environment we're in, we cannot facilitate any more than 3 or 4 of the family. So if there's a large family gathering, that we can involve them linking onto the link and they can be involved in the patient's care.
It could be afar and because of restrictions of COVID, they're not allowed to see them. So this helps bridge the communication gap and lets them see the family face to face.
The families will be included in the meetings, families, the patient and then the healthcare professionals involved with the patient. It's a good way of having an open conversation with the patient and their family as well.
The idea of video-enabled care is really good and to have a huge impact on everyone's future life.
Looking at the future is integrated care, and integrated care is integrated teams. So we're going to have perhaps a community geriatrician who's not always going to be able to go out to somebody's home. Video-enabled care is the future. I know we can never replace the face-to-face contact. We're in a pandemic, the video-enabled care has highlighted how much we can connect with each other.
As a team, we supported the planning for introduction of video-enabled care in our pilot site, and we linked with the site regularly, both virtually and in person. We evaluated 15 use cases ranging from uses for health and social care professionals and advanced nurse practitioners to social interaction and well-being for residents. We carried out 15 qualitative semi-structured interviews with staff, residents and families. We developed a web-based video-enabled care toolkit, which includes a website to support the implementation and ongoing use of video-enabled care. We also developed and tested a range of implementation resources for the on-site teams and residents, which include templates, documents, flyers, a quick reference guide, a demonstration video, and a roadmap for implementation in older person services.
Using a set of semi-structured interview questions, we sought to gather meaningful data from various stakeholders associated with video-enabled care at the pilot site. The purpose of this process was to identify insights from residents, relatives and staff in order to provide an evidence base to inform our overall project. Over the course of 5 site visits, 15 qualitative interviews took place, lasting approximately 4 hours in total. Residents, relatives and a wide range of staff members took part. A set of predominant themes were elicited from these interviews and are illustrated here. These include the importance of digital literacy and effective leadership for staff, the clinical and social benefits for residents and relatives, and the ease of platform use across all cohorts. These observed themes were used to guide and inform the production of subsequent project outputs.
Here we have a demonstration of our web-based video-enabled care implementation toolkit. This website was designed with usability in mind. There are a wide range of resources available to view and download, and it is hoped that this toolkit provides the appropriate information to enhance implementation of video-enabled care. The term VECI is an affectionate and respectful way of referring to older persons in the Venetian language of the Italian Alps, and was originally associated with veterans of the Italian Army. It is also our acronym for Video-Enabled Care Ireland, and we felt the association with this term was a great fit.
Throughout this digital transformation project, we gained valuable insights, knowledge and understanding in relation to the implementation, scale-up, spread and sustainability of video-enabled care in older person services. Moving forward, some next steps must include engagement with the HSE National Virtual Health Team regarding sharing of the website and resources to support future pilot sites with their implementations. To evolve, evaluation must be extended nationally to gather feedback and ensure the benefits are realised. We strongly urge clinicians, services, leaders, decision makers and researchers to embrace this project, which we believe can support effective implementation, spread and scale up. This will ensure the future sustainability of what is set to be an intrinsic element of future healthcare delivery in older person services in Ireland.